Hi, I'm Dr. Matt Rasmussen here with Periodontics and Implant Dentistry of Tallahassee. Recently, we've been getting a lot of questions regarding dental hygiene and dental hygiene practices, so we wanted to spend some time today to go over the roles of the dental hygienist, the different types of appointments that are associated with those dental cleanings. Proper dental hygiene really encompasses a couple of different components. The first component is to make sure that we have adequate home care, meaning that we're going to use anything to get any bacteria off of the teeth, both in the fronts as well as in between the teeth. In addition, there's a professional component to that, which we'll discuss further below. If you don't practice good dental hygiene, a number of different things can occur. Cavities, or otherwise known as caries, can develop on teeth. Additionally, gum and bone loss and other issues may eventually lead to tooth loss, as well as abscesses and a lot of discomfort. A dental hygienist has a number of duties. The main one is to make sure that any bacteria that's on the teeth is removed. They also have a role of coaching the patient with proper techniques and motivating patients to have adequate home care. A dental cleaning has a few different components. The first will be a review of the medical history and to make sure that everything is good to go for that day. There's also an education component, so taking the time to go through proper brushing and flossing techniques and showing the patient where they are adequately and inadequately keeping the areas clean. The most lengthy portion of that appointment is going to be to remove any bacteria that's on the teeth and polish them so that the patient's good to go. Dental hygienists use a number of different tools to get the areas clean. Oftentimes they'll use certain hand tools, often known as curettes and or scalers, that are used to remove hard pieces of tartar or buildup off of the sides of the teeth. In addition, they're going to use a machine called an ultrasonic, which is going to work in a more mechanized way to get any bacteria off of the teeth. And then they'll polish the teeth after the remaining portion of the cleaning has been completed. The goal of a dental hygienist's teeth cleaning is to make sure the patient's always comfortable in the chair. There are a number of different types of dental cleanings, depending on how much bacteria is on the teeth and how deep below the gum they have to go. In the event that a particular type of cleaning goes farther below the gum, in our office we make sure the patient is always comfortable by using different types of anesthetics so they're not going to feel any pain during the procedure. A dental cleaning length of the appointment depends based off of the type of the cleaning. It can be as short as 30 to 40 minutes for someone who does not have a significant amount of bacteria or buildup on their teeth, all the way up to a couple of hours for part of the mouth when in the event of something like a deep cleaning. A deep cleaning is necessary only when certain diagnostic criteria have been met. In some people, gum and bone loss begins to occur because of bacteria that's on the teeth. Unfortunately, there's a disease process that starts and the bone starts to peel away and the gum stays a little bit higher. This creates a little crevice, which is impossible for us as people using brushing and flossing to keep the areas clean. Therefore, the first step into getting the patient back healthy from this periodontal disease process is to do a deep cleaning, which means we'll have to get the patient numb, get underneath the gums, and get any bacteria out of those pockets that we cannot reach at home. After dental cleaning, it's important to take the advice that your hygienist has given you in regards to appropriate home care afterwards. You have to remember that the hygienist's role is supplemented by adequate home care after the visit. If you don't practice good dental hygiene, a couple of different disease processes can occur. The most common ones that people know about is commonly referred to as gum disease. That is also referred to as periodontal disease, bone loss, and can be seen with bleeding gums and eventually going to be loose teeth, and you may even lose teeth. Additionally, cavities can develop without appropriate home care. The dental hygienist has a number of main duties. The first are going to be involved with education. So the patient is going to have their medical history reviewed, and the hygienist is going to take the time to show proper brushing techniques and flossing techniques in areas where the patient may not be getting adequate access to, meaning that we may see bleeding in some of those areas. Of course, at the actual dental hygiene visit, this main component is going to be to remove any bacteria off of the teeth. To schedule a hygiene appointment, please give us a call at area code 850-692-9200. I hope we've had a chance to answer some of your questions regarding dental hygiene. We look forward to talking to you further at our visit coming up. Thank you.